Senate Committee on Health, Education, Labor, and Pensions will please come to order. Today, we are meeting to discuss and vote on the following items of business. The nomination of Jose Javier Rodriguez to be Assistant Secretary for Employment and Training at the Department of Labor. The nomination of Michael Smith to be Chief Executive Officer of the Corporation for National and Community Service. The nomination of Sandra Bruce to be Inspector General of the Department of Education. The nomination of Larry Turner to be Inspector General of the Department of Labor. The nomination of Deirdre Hamilton to be member of the National Mediation Board. The nomination of Gerald Fouth to be a member of the National Mediation Board. The nomination of Linda Puchala to be a member of the National Mediation Board. And the nomination of Amy Lloyd to be Assistant Secretary for Career, Technical, and Adult Education at the Department of Education. The Office of Government Ethics has reviewed all the nominees' credentials and found they are in compliance with applicable laws and regulations governing conflicts of interest. These are all qualified nominees who are committed to serving families, students, and workers across the nation. I'm very proud to support their confirmation. I hope all of my colleagues will join me in voting them out of committee today. We will start with a roll call vote on Jose Javier Rodriguez's nomination, and then we will voice vote the remaining 7 nominees en bloc. Senator Murd, do you have any opening remarks?
I do, Madam Chairman. I want to thank you for holding this markup. While these nominees serve necessary roles, I'm still very disappointed and perplexed that we haven't yet had a hearing or a markup on the nominee to be the FDA commissioner. Janet Woodcock's doing a fantastic job as acting commissioner, and I hope she stays as long as she wants. The FDA needs a full-time commissioner. This is a dereliction of duty by the administration, and they need to do better. I also want to talk about something else that should be considered in a legislative markup in this room, reconciliation instructions, that this committee report out legislation that spends $750 billion over the next decade. You can understand why we're confused on this side of the aisle amid all the secrecy and the backroom deals that are being cut. When parents around the country rise up in concern about dangerous and shoddy educational curriculums being sneaked into the classroom, about hiding sexual assaults from the parents because it doesn't fit a convenient narrative, and when the Attorney General threatens to use the Patriot Act against parents that are upset about these developments, I'd probably want to hide the ball on that agenda too. But when liberal activists harass Democratic senators and follow her into the bathroom to demand she submit and become compliant, and when they paddle upriver to disturb a senator and his neighbors, we're all told that's just part of the process. So when a conservative agenda is pursued, you use tools that call them terrorists. But when a liberal agenda is pursued, everything's on the table as part of the process. I guess that explains why the traditional process, working things out in the light of day in a hearing and a markup with colleagues across the aisle, is so much less appealing. It's easier to have proxy harass someone in the bathroom than it is to take a tough vote in the committee room. But today I'm proud to remind my colleagues that on this committee, one with instructions to spend $750 billion, we have some of the most able members of the Republican caucus who know how to get results. Susan Collins has been in the Senate for 25 years. She's had an unending supply of bipartisan laws signed by presidents and more bills on the way because she knows how to get things done. Susan's a proven ally in securing funds for child care, community college, and access to health care. Rand Paul's a medical doctor, a noted contrarian, but his questioning and forceful advocacy for individual liberties often leads to improved legislation. Dr. Cassidy is a proven leader in mental health and education and for children with disabilities. He's demonstrated a willingness to think outside the box and pursue novel approaches to legislation. Lisa Murkowski is a fierce defender of Alaska and reminds us all regularly that what works in the lower 48 doesn't translate well to her home state. She knows the cost of child care and college are sky high and brings decades of experience at working across the aisle to find lasting solutions. Mike Braun's a proven leader in healthcare, businessman who actually lowered healthcare for his employees. He knows that solutions don't come from government, but from innovation and experience. Mitt Romney brings a deep knowledge in private sector management and public service. As one of 2 former governors on this committee, he knows how state budgets work. He knows the importance of getting things right the first time because cleaning up someone else's mistakes is tough and it's expensive. Tim Scott's a fierce defender of parents and children and has fought his whole career to help families get across for a high-quality education. He knows that supporting parents' control over their children's education is the moral thing to do. Roger Marshall, another medical doctor who knows a fair bit about how to make health care more affordable, and he wants to fix the broken CDC and improve our ability to respond to the next pandemic. Tommy Tuberville. Tommy's new to the Senate. We call him Coach. He's also new to elected politics. But Coach has a deep knowledge of how to build a team, the power of education, and knows that working together only makes our country stronger. Republicans waived our rules to allow two Kansans to serve on the same committee, so Jerry Moran could serve with us. He knows the importance of looking out for rural communities and allowing flexibility in programs to best serve counties that are almost as big as some of the smaller states. These are all serious legislators with broad expertise and knowledge. They bring different worldviews and perspectives that add tremendous value to the bills before this committee, if only given the chance. Shutting them out of the process, denying them the opportunity to question witnesses and to offer amendments, doesn't bring a country together, doesn't create a platform for long-term solution. It further weakens the bonds that are so important to this institution. I hope the course will change. Maybe then we can get back to the reason the voters sent us here, to work together to improve their lives on ideas that we all agree on, not just growing government for the sake of growing government. I'll remind my friends, as Ronald Reagan pointed out, the socialism only works in two places, heaven where they don't need it and hell where they already have it. I thank the chair.
Are there any other senators who wish to make remarks before we move to votes on these nominations?
Madam Chairman,
Senator Collins.
I have enormous respect for the chair of this committee, and you and I have worked together on many issues over many years. I also have enormous respect for the ranking member, and I know that the two of you can continue the long-established tradition of this committee of working together, whether it's on health care or child care or education. That has been the tradition of this committee. I'm concerned that the Health Committee has received an instruction for $726 billion, and yet we've not held hearings or a markup to take a look at the elements of that massive package. That amount of funding is more than 4 times the amount of discretionary funding we dedicate annually to the entirety of our departments of health, education, and labor. And I just want to urge the chair to work with the ranking member, as you have on so many occasions, to produce a more thoughtful approach to what is included in this package. And again, that's been the tradition of this committee, and it's been the history of our two leaders. So I just want to add my encouragement that we can do it in this committee. We've shown that we can do it. Thank you.
Thank you. Are there any other senators? Senator Braun.
Thank you, Madam Chair. You know, when you look at the name of the committee, Health, Education, Labor, and Pension, my feeling, those first two, health and education, for most American families, your well-being physically has got to be of great concern, and then how you're edified through education would be there probably as number 2. We should all probably be in agreement, in sync there. And I think the journey that we're on is how you do it sustainably and what part of government should weigh in most on it, or how you hold the private sector accountable to do its share as well. Briefly on health care, it's the driver of our structural deficits. High cost of health care across the system within a broken industry that operates more like an unregulated utility than it does a business that I know works, where you have competition, you have full transparency, you play by the rules that make American enterprise work. So I think we're straddling a very tricky spot to where we're asking government to do more when it hasn't necessarily knocked things out of the park, especially in healthcare. On the other hand, we've got to hold an industry accountable that, in my opinion, drives most of what ails us budget-wise, not to mention what we're currently contending with, where we're asking an institution to do even more, and we're probably going to pay for it mostly on the back of future generations by borrowing a lot of it. I just think we are on a unique committee that probably is involved with the things most dear to most American families, and I'd say that we need to take a more responsible approach to not overburden a federal government that is already doing things and not paying for it. On the other hand, not to let a broken institution like healthcare that doesn't operate in the true realm of competition and transparency. Education has many of those same parallels. I looked at what Mitch Daniels in Indiana has done, where he's run that in a way that's made it more entrepreneurial, more businesslike. The rest of our institutions across the country, where we suffer with most of the high cost of education that has now eclipsed that of annual rates of increase over healthcare, what a notorious kind of place to be. We need to look at things a little differently, and if it's using the same approaches and paradigm, I think we're going to be disappointing the American public down the road. Thank you, Madam Chair.
Thank you.
Madam
Thank
Chair.
you. Yes, before the senator speaks, I do appreciate everyone's remarks. We do want to vote while we have a quorum. Before I call on Senator Sanders, I do want to say I appreciate the remarks of my colleagues. I will say in recent years this committee has not met to mark up reconciliation. That has been true under both parties. My Republican colleagues are aware of that. As they tried unsuccessfully to use reconciliation to repeal the Affordable Care Act back in 2015 without a hearing, without a markup. And in 2017, my Republican colleagues came within a single vote on the floor of using reconciliation to take health care away from millions of people without a hearing, without a markup. So the difference isn't really about process, as both sides have pursued this strategy when reconciliation is involved. It is about priorities. And let's be clear, the American people want results, not arguments over process. And that is why I am committed, along with all of my colleagues here, to pass legislation that will provide our families with quality, affordable child care and universal preschool and paid leave and home and community-based services and more opportunities to pursue a higher education. That's why I want to see us expand Medicare benefits and close the coverage gap and let Medicare negotiate drug prices lower and extend the health care expansion from the American Rescue Plan. So we have a lot of work in front of us. I am pushing to get as much as we can of that done and Build Back Better. These are ideas that this committee has discussed for years here on the committee and elsewhere that have broad support across the nation, and I believe it's time to get them done. So again, I do appreciate everybody's remarks. I'm sure we'll hear more about this, but we do need to vote while we have a quorum, and we can continue this after we have a vote. I will call on Senator Sanders. If anybody else feels urgent that they'd like to speak before we have the vote, I will accommodate that, but I will stay after if anybody else wants to make additional remarks. Senator Sanders.
Thank you, Madam Chair. And it's not quite urgent, but I did briefly want to respond to some of the remarks of my colleagues. In terms of health care, we have a simple issue. Is health care a human right in which all people, regardless of income, are entitled, or is it not? It's a fundamental question. I happen to believe that it's a human right. Is there something wrong, my friends, when the United States is the only major country on earth not to guarantee health care to every man, woman, and child? Yeah. I think we are the odd guys out. I think the other countries are right in saying that all people are entitled to health care. And in the midst of all of that, is there something maybe wrong when you got 90 million people in this country who are uninsured or underinsured, with high copayments, unaffordable premiums, etc., and yet we end up spending by almost twice as much what other countries on earth are spending. I live 50 miles away from the Canadian border, and somehow or another they do manage to provide quality health care to all of their people, spending approximately 50% per capita of what we're spending. And you got the pharmaceutical industry. I don't know if we have any lobbyists here because they're all over Washington right now. You got 1,500 lobbyists of the pharmaceutical industry. They spent $300 million trying to defeat our ability to finally negotiate prescription drug prices with Medicare. $300 million in lobbying alone. That's called a broken system. So I say to my Republican friends, you tell your constituents why in some cases we are paying 10 times more for the same drug as people in other countries. Yeah, the system is broken, but the answer is not to give more power to the pharmaceutical industry or the insurance industry. The answer finally is to guarantee health care to all people as a human right.
Thank you, sir.
Madam Chairman, I feel a need to respond to that.
Okay, and
I'm not going to give a long response, just this, which is there are a lot of things in the pharmaceutical industry that I think are terrible. I'm sure things we need to improve. But I would note this. It is the American pharmaceutical system that came up with the vaccines that are saving the lives of Americans and people around the world. And the innovation in our country is something we can applaud and appreciate. So as we look at changes we want to make, let's make sure that we don't do things that harm many of the great goods that come from the system we have.
Thank you. And with all due respect, and I appreciate everybody's arguments, we all came here to the Senate to argue, and we have that right. But we do have nominees that need to get out. I need to do that while we have a quorum, so I'm going to ahead and call the votes. If anybody would like to stay and continue this debate, I'm happy to stay here for as long as we need. Our first order of business today is to approve the nomination of Mr. Rodriguez to be Assistant Secretary for Employment and Training at the Department of Labor. Seeing that a quorum is present, as required by the committee rules and the standing rules of the Senate, I now move to favorably report the nomination of Mr. Rodriguez to serve as Assistant Secretary for Employment and Training at the Department of Labor, and the clerk will call the roll.
Senator Sanders?
Yes.
Senator Casey? Aye. Senator Baldwin? Aye. Senator Murphy? Aye. Senator Kane? Aye. Senator Hassan? Aye. Senator Smith? Aye. Senator Rosen? Aye. Senator Lujan? Aye. Senator Hickenlooper? Aye. Senator Burr?
Votes no.
Senator Paul?
No by proxy.
Senator Collins?
No.
Senator Cassidy?
No by proxy.
Senator Murkowski? No. Senator Braun? No. Senator Marshall? No. Senator Scott? No. Senator Romney? No. Senator Tuberville? No. Senator Moran?
No by proxy.
Chair Murray?
Aye.
I have 11 ayes, 11 nays.
The motion is tied in accordance with Section 3 of Senate Resolution 27. I will transmit a notice of a tie vote to the Secretary of the Senate, thereby giving either the majority or the minority leader the authority to make a motion to discharge that nomination. Our next order of business today is to approve the following 7 nominations. The nomination of Michael Smith to be Chief Executive Officer of the Corporation for National Community Service, the nomination of Sandra Bruce to be Inspector General of the Department of Education, the nomination of Larry Turner to be Inspector General of the Department of Labor, the nomination of Deidre Hamilton to be a member of the National Mediation Board, the nomination of Gerald Fouth to be a member of the National Mediation Board, the nomination of Linda Puchla to be a member of the National Mediation Board, and the nomination of Amy Lloyd to be Assistant Secretary for Career, Technical, and Adult Education at the Department of Education. Seeing that a quorum is present, as required by the committee rules and the standing rules of the Senate, I will now move to favorably report these nominations. All those in favor say aye. Aye. All those opposed say no. The ayes have it. I would also like unanimous consent to enter into the record 3 letters in support of Mr. Smith's confirmation, 2 letters in support of Mr. Rodriguez's confirmation, 1 letter of support of Mr. Lloyd's confirmation. So ordered. Senator Burr, do you have any additional remarks? No additional remarks. Is there any other senator who would like to be recognized? Senator Kane.
Thank you, Chair Murray. I just want to respond briefly also to comments made by colleagues, because I've heard colleagues talk about the, why aren't we marking up the reconciliation bill in committee? And I was like, you know, I've heard that argument before, because I made it. I made it here in 2017 when the effort was to repeal the entire Affordable Care Act and take health insurance away from tens of millions of people and potentially remove their protections from discrimination based on pre-existing conditions, in the equity that had been required by the ACA for women so that it wouldn't be discriminated in premiums, allow children to stay on family policies till age 26. It would have been good to have a Help Committee hearing on that. It would have been good to have a Finance Committee hearing on it because it dealt with Medicaid and Medicare. But what I heard when I made that argument in 2017 is on reconciliation, take it to the floor. Take it to the floor. You have unlimited amendments. Take it to the floor. That was my first real experience in the Senate of reconciliation. And so, you know, I kind of learned from that experience. And the experience is on reconciliation, take it to the floor. Now, whether that's the best way to do it or not, that is the way it has been done on big, important matters here. And I have no doubt when we get to the floor, it's going to be extremely robust in terms of the amendments that are offered to the package that's put on the table. Second, I do just want to weigh in on the back and forth between Senator Sanders and Senator Romney. I share Senator Sanders' deep concern about prescription drug pricing, and I really hope in this bill, Chair Murray, that we're going to be able to do something that will address it. But I also believe the success story of the American vaccines has been powerful, and we shouldn't just demonize the pharmaceutical. I think if we want to tackle prescription drug pricing, we've got to go after PBMs, we've got to go after insurers, we've got to go after providers, because it's often not just the manufacturer that is responsible for the sticker shock that people are experiencing when they go to the pharmacy counter. I understand why they're mad. I understand why they don't like prices that go up and up and up. But there are some parties that are responsible for that don't often get the attention that they should get by this committee and others. And I hope as we're grappling with affordability strategies, we're not just going after one participant and ignoring others who often, I think, contribute even more to the price challenges that we have. Thanks, Chair Murray.
Thank you, Senator. Any additional remarks? Senator Casey.
Yeah, real quick. First of all, Patty, or Madam Chair, I want to thank you for the way you've always conducted your work on this committee as chair, as ranking member, and the work you do with the ranking member, Senator Burr. And prior to that, when Chairman Alexander was chair and you were ranking member, and I think that will continue, and I know it continues even today. I just want to punctuate, though, or emphasize the recent history. I mean, it wasn't long ago. It was 2017 when Republicans in the majority took a tax bill from basically Thanksgiving to Christmas and rammed it through. That was reconciliation. We didn't like it. We didn't vote for it, but they had the majority and they did that. The health care bill is a little different. It was getting rid of a bill, and there were obviously, as Senator Kane mentioned, 2 committees involved, but that was also a reconciliation process. So I think at its core, what the complaint isn't simply about processing a committee or 1 or 2 committees. It's about reconciliation, and that's where there's a disagreement when one party has a majority. But I think it bears repeating that when Republicans had a majority, they used reconciliation for trying to get rid of the Affordable Care Act. They didn't get that done, but they were successful at using this same process to change the tax code in a way that it had not been changed in 33 years. I mean, when you think about 1986, or 30 years, I should say, 1986 to about 2017. So I think that's where the complaint is, but I have no doubt that the chair and the ranking member will continue to work together and move this committee forward. Thank you, Madam Chair.
Thank you. Any other senators? Senator Scott?
Thank you, Madam Chairman. And ranking member, thank you for your opening comments. I see our colleague, Senator Sanders, has left, and I will say that America and our government is obviously serious about providing quality health care to as many Americans as possible. I think we spend somewhere near $400 billion for VA. We spend over $520 billion on Medicare. We spend probably $350 to $400 billion on Medicaid. We spend $200 or $300 billion on Obamacare. We have provided somewhere near $1.7 trillion for healthcare. We spend about $800 billion as a nation on public education, K through 12. But unfortunately, in the poorest zip codes of this nation, the system fails those kids, so that the quality of your education determines the quality of your life so often, and yet the poorest kids have too few options for quality education, and we fuse together the quality of your education with the quality of your future. I didn't come here to argue about the issues. I came here to make a difference about these issues. And frankly, I don't think we have done a good job making a difference for the average person in this country who watches the processes and the performances here in Washington, and they are sick to their stomach. And so when we hear that what we need is more money, and we have actually no conversation, no debate over what we're going to do with the money, of course it's frustrating. I hear my friends on the other side, and I watched in 2017 as we passed tax reform through reconciliation. As you said, Bob, without any question, we did it. What was the result of that reconciliation package? Well, it was in 2018, it was a 3% increase in revenue to the Treasury. In 2019, it was a 3% increase in the Treasury as well. And over those 3.5 years, we saw $4,400 come back to the average American family. We saw taxes for a single mother like the one that raised me go down by about 70%, her tax burden to the federal government. We saw about a 60% reduction in taxes, federal taxes, for working class Americans. If you're looking for a way to attack the rich, we actually created a system of taxation that is still progressive. But what we said was a little different. We said that actually creating incentives like the opportunity zone so that those who have will reinvest in places that don't, bringing about $75 billion back to the poorest Americans who happen to be consistently, disproportionately people of color. What we're concerned about in this process of reconciliation is not simply the process that we reach the end goal of getting it passed, though I am going to yell and scream about that too. It's what we're doing to the American people and not for the American people through this process with a equally divided 50-50 Senate with a 3-seat majority in the House and with a White House that's controlled by the party. If I were in charge, and I'm not, obviously, I would be thoughtful about deliberating, discussing, debating, disagreeing on those tenets or principles that we think move America in the right direction. This process has been missing. We're talking about spending more money this fiscal year than any country on earth has ever spent. And we're going to do that in the most partisan way. And I know the voters are watching, and I hope that the response and reaction that they have is an allergic reaction to this process and to the spending, because ultimately, and I predict this, in 3 to 5 years when we measure poverty in this country, it'll be worse than it is today. What we saw after the 2017 tax reform, we saw poverty hit the lowest level ever recorded. We saw the unemployment numbers hit the lowest numbers ever recorded. We saw labor force participation rates in the poorest communities go up. We saw the long-term unemployed come back to work. What are we seeing today? The exact opposite. So yes, we are frustrated by the lack of transparency that this nation has on the largest spending packages in the history of the country. And we're frustrated by the fact that when you call a COVID relief package a $1.9 trillion COVID relief package, COVID relief, but less than about 1% goes to vaccines and 9% goes to COVID-related health. Yes, we're concerned about the definitions of the words we're using when we have an infrastructure package that has about 10% in the next 5 years for roads and bridges. It's frustrating because the American people believe the words we use because the words we use are containers of power. And yet we deceive the American people in our packages by naming them something that sounds good, but the details are so murky you can't figure out what it is. And we're doing it again. At least when we talked about our reconciliation package, we said we are going to cut your taxes. We're going to return $4,000 to your household. We're going to make it easier for you to make decisions because we believe expecting 535 people in Washington to know what 330 million people should do with their money is ridiculous. So we'll give it back to you. You make your decisions. It actually works.
Senator Marshall.
Thank you, Madam Chair. Let me follow up on Senator Scott's concerns that people back home having an allergic reaction to the policies. It's actually an anaphylactic shock that the people of this nation are having. You know, my grandma had many old sayings, and one of them is that 2 wrongs don't make a right. 2 wrongs don't make a right. And certainly I was not here in this body with the reconciliation package, but the arguments is basically what I'm hearing from the other side is that 2 wrongs would make a right. When I hear my friends, my colleagues across the aisle talk about health care, we agree on so many of the same goals. So many of the same goals that we want every American to have access to health care. And I think they do. I really do think that they do. We share that same common goal, and there's always opportunity for improvement. I'm so proud that any hospital I was affiliated with, any clinic we did, saw every patient. We never did a wallet biopsy. We saw everybody, and we took care of everybody. I was so proud to help sponsor health departments, county health departments that use local, state, and federal funds, and to provide free family planning clinics wherever I worked. So proud when I got to Congress to help fund community health centers, which do a great job. I just don't know where people would come off saying that Americans don't have access to health care, because I think that they do. I do think that they have access to health care, and that's, again, the goal we share in common is how to have true access to meaningful health care at an affordable price, and that's why I came to Congress. One of the reasons was to make sure that we had quality health care at an affordable price, but where we disagree is on how to get there. One solution would be a Medicare for all, socialized medicine, and mine is the opposite, where I want to give people more choices, but drive down the cost of health care. I think we all acknowledge the cost of health care is just almost unattainable. It is absolutely a nightmare for so many people, the cost of health care. I'm glad to see Medicare Advantage prices stabilizing. That's a situation where we're giving people more choices, and it's driven down the price of health care and stabilized prescription drug prices. The prescription to drive down the cost of health care is more transparency, more innovation, and consumerism. Consumerism being letting patients be consumers again. Otherwise, we're going to end up with diluted health care, rationed health care, and lack of innovation. Several colleagues have mentioned the innovation of new vaccines, miracle vaccines that have saved millions of lives. The ability of a pharmacy to have new drugs that instead of a person having a liver transplant, we have a medicine they take once a week for 12 weeks and it cures them of hepatitis. Those innovations aren't going to happen if we overreact and we put too many lids. I think we need to talk about the true cost of what's driving up the cost of health care, a meaningful discussion about the cost of prescription drug prices and who's making that money. We need to talk about the administrative burden that we've created in health care, where we've seen the numbers of health care administrators go up exponentially in my career in medicine, but the number of physicians staying flat. When we talk about driving down the cost of health care, I'm shocked to think that we want to pull the rug out from under the physicians who ran to the sound of the battle and saved so many lives, and we want Medicare reimbursement cuts for physicians going forward this year. We already have a shortage of physicians. We have a shortage of nurses, and our policy is exacerbating that. I do think there's very meaningful discussions that need to be had in this, but 2 wrongs don't make a right. Thank you, Madam Chair.
Thank you. Are there any other senators who wish to be recognized? Thank you. Thank you to all the senators who expressed their views today. That concludes our business. The committee will stand adjourned.